So, part 3 of my podcast is on Indigenous health and access to care. Throughout this semester, I've learned a large amount on the barriers the Indigenous community has faced and are still facing today. The colonialist past of Canada, as well as the impacts of residential schools had on Indigenous communities, were truly heartbreaking to hear. However, they are a great opportunity to reflect on past trauma and find a great way to move forwards in our care. One article by Tremblay states that due to colonialism, Indigenous communities are still facing a larger amount of social inequities comparative to the general population. This article talks about how this can be explained with the democratic idea of how everyone is to be treated the same. Through relational inquiry, we can tell that not everyone needs the same care, and each patient will have their unique wants and needs. In healthcare, it's important to understand the difference between equity and equality and when to apply them. In an article based on Stomping Out Systemic Racism by Curtis et al., this article goes into depth about how culturally safe care may be a better option than culturally competent care. I found this a great article to read as it talks about the concept of how culturally competent care can be seen more as a power imbalance, as it is the ability of systems to provide said care. Cultural safe care, however, is seen to be more self-reflective in a way to remove that power imbalance within the system and reach as much reconciliation as possible. I would definitely recommend giving this article a read, as it really made me reflect on what I think culturally safe versus competent care actually is. So this learning has made me really focus on providing culturally safe and competent care, listening to your patients, their past experience, and any holistic or spiritual aspects they would like integrated into their care is not only crucial to form therapeutic relationships, it's also simply just ethical. In my future practice, I hope to provide the most culturally competent and safe care that I can to ensure that everyone feels safe and welcome within my clinics.